well, since 1972, really, over the last 30+ years, they did studies combining trans fat with hydrogenated fat, partially hydrogenated fat, and saturated fat. They clumped them all together, and because those studies indicated that those fats together were bad for your heart health, saturated fat was just no good for you. Well, finally, there have been studies done that have separated saturated fat from the other fats and found that saturated fat is not as bad, as it was once felt to believe. That doesn't mean you want to eat butter by the stick or stick a popsicle stick in it and eat it, but like my wife might do. But butter's not that bad for you. And again, moderation is the key to anything. So
we use it on bread and on toast.
That's fine. You're better off to do that because it's the trans fats that'll get you.
Well, you take margarine, it looks like it's got plastic in it.
Yeah, well, a lot of that's that stiff, gunky stuff, paraffin or wax, or a lot of it is just the hydrogenation process, that creates such bad fats. Of course, exercise is important. We have a little program that we put together called a 10,000-step walking program. The federal government has a 10,000-step walking program. They're easy to find, these kinds of programs. And what we usually recommend is just get a pedometer, and if you don't have one, I'll give you one. And put on your belt, and just start measuring your steps. And the best way to do that is for the first 2 or 3 days, don't do anything different about your activity level, just to see how many steps you walk during any given day. And then start setting goals of every couple of weeks, increase the number of steps by 10%, with the goal eventually to get to 10,000 steps. And of course, exercising with a buddy makes it a whole lot easier, especially on days when you don't want to do it. Your buddy may be enough of a prod to make you exercise on days you don't want to. If you smoke, quit smoking. One thing with smoking, and some of the studies that have been recently published about smoking, is that you immediately see an increase in HDLs, the high-density lipoprotein, the good HDLs. Drinking alcohol in moderation, is not bad. Drinking a glass of red wine in the evening, or even drinking a stout beer, actually helps improve HDLs in your bloodstream. So alcohol is not necessarily all bad, but again, in moderation. That doesn't mean you want to drink 6 bottles of wine every night to increase your HDL levels, because it has more adverse effect on your liver. But that's okay. And of course, nutritional supplements can also help a great deal. Now, Dee, your question, lab values for optimal cholesterol. Currently, the ideal level for your cholesterol should be 200 or less. If you're in that range, you're in pretty good shape. Serum cholesterol greater than 250 milligrams per deciliter increases the chance of heart attack by 50 or 500%. That study was done several years ago. Whether that number is still accurate, I'm not quite so sure, but since that's the number we have, that's the number we'll go with. So the bottom line is, you don't want elevated cholesterol. You want to keep it within normal limits, but you don't want to have it so low that you can't produce hormones, and so low that it doesn't help increase the flexibility and strength of the cell walls in our body. So keeping it under 200, and even if you're 190, 198, you're fine with that. Nothing to get excited about. I have patients that come in and their cholesterol is 204, and the doctor immediately wants to put them on a statin medication. And a number like that is so easy to drive down below 200 just with diet and exercise, and it doesn't make any sense to me sometimes. The low density lipoproteins, those are the norms, and again, those are in those handouts I gave you. Anything 160 or higher is really high, and that does need to have some work. Less than 130 is good. The general standard right now is anything less than 100 is where you want to be, because most of us, believe it or not, do have cardiovascular risk factors. And we have cardiovascular risk factors because it could be due to heredity, it could be due to our diet, it could be to lack of exercise, could be due to the fact that we're overweight as a population in general. So now the norm is considered to be 100 or less. And if you have heart disease, keeping it at 70 milligrams per deciliter is a number you should really strive to obtain. Driving it below that, I don't know. If I have patients that have cardiovascular risk factors or certainly have heart disease, what I would do, I would send them out to a lab and get an oxidized LDL study done to find out truly where we have to keep this number. Because if you drive it below 70, which again, I have patients through cardiologists want them to be that way, I just don't know overall for their health if that's really a smart thing to do. But again, I can certainly understand if you only look at the heart and only look at a patient with cardiovascular disease, why 70 might be a goal. HDLs for men should be between 40 and 50. Women between 50 and 60. I think if you can get it above 60, that's ideal. That's something you can strive to obtain, and it's something I think easy enough to do with diet, exercise, and nutritional supplements. So what about food? What kind of foods can you incorporate into your diet to lower cholesterol? I've listed the top 5 that I found, through my reading. Of course, oatmeal or oat bran is a good choice. And in your packet of information, there is a list of soluble and insoluble fiber foods, just so you can use as a reference for yourself. But oatmeal, oat bran, it's good. The commercials with oatmeal being healthy for cholesterol, it's a true commercial. But that's a good choice. Walnuts and almonds are good choices. Most of the nuts are all good choices for lowering cholesterol. They have the good healthy fats in them. Peanuts don't count because peanuts aren't really nuts. But walnuts, almonds, macadamia nuts are one of the most healthy nuts you can actually eat.
Oh, really?
But not chocolate covered ones. Not
No.
chocolate covered ones.
I love macadamia.
And no salt, is it?
Pardon?
And no salt.
I would get no salt, and I would get them raw if you could. Because if you get a handful of nuts, you put them on a napkin. If there's a lot of oil in there, those oils are very inflammatory to your body. So if you can get a raw nuts are the best nuts, and no salt. And whether they're lightly salted, Glenn, I don't get as excited about salt, maybe as a lot of doctors might. If you have kidney problems, maybe if you have blood pressure issues, you got to be a little more salt conscious. But I don't get too excited about salt. And the reason I don't, because I don't think it has that much of an adverse effect on blood sodium levels. But with salt, that's one of our primary sources of iodine, oxidized, that's fortified with iodine. And iodine is extremely important for thyroid function. And we find a lot of patients that don't get enough iodine in their diet have
A real
thyroid
quick thing
issues.
about salt, friends of ours, he was having problems, fainting, passing out. He went to the emergency room ever so many times, but it was heart related. Finally, he went to a different doctor, and the doctor asked him, "Do you use salt?" Bob said, "No, nothing." He said, "You start putting salt in your food, and you won't have these problems."
So fixed it.
Fixed
Yeah,
it.
yeah. I think that we just,
Bob Easterday.
Yeah.
I think we all just get a little too paranoid with what we hear in the news and the media, just based on what a scientific study might tell us, and all of a sudden it becomes a taboo, and it isn't. You have to think about if you're not getting enough mineral in your body, you're not going to get enough electrolytes in your body, which is, sodium, potassium, chloride. So it's important. And again, omega-3 pops up. Again, fish oils are good. You can also get omega-3 through flax seed or flax oil, but the most readily available source of omega-3 is EPA and DHA, and the National Institute of Health actually even recommends 1,000 to 3,000 milligrams of that a day. Extra virgin olive oil, we've already talked about. Coconut oils, and also an excellent source to help reduce cholesterol levels. And also plant sterols are extremely important. And an example of a plant sterol would be any product that has soy, lecithin in it. But lecithin is an excellent mechanism to help lower cholesterol levels. The top supplements that lower cholesterol, polycosanol, as I mentioned earlier, it's found in the leaves and rinds of citrus fruits. It helps normalize cholesterol. It inhibits the oxidation of LDLs. It inhibits clot formation, and also inhibits thromboxane, which basically helps reduce the accumulation or aggregation of platelets, which can cause clotting. Fiber is another simple thing we could do. Fiber is important because fiber, in a soluble form, and again, this soluble fiber list I have listed, actually when you ingest that type of fiber, it almost becomes I'll just call it a mucus glob, and it actually bonds itself to cholesterol and to sugar, so it prevents a lot of that from being absorbed into our bloodstream. The soluble fibers are excellent. Insoluble fibers are important because they help kind of cleanse our intestines. They act like a broom that cleans the intestine. So having a good combination of soluble and insoluble fibers today is important for overall health, but also trying to ideally work your way up to ingesting about 35 milligrams a day is important as well. If you're not a fiber consumer, you shouldn't start out trying to eat 35 grams a day because you'll have so much intestinal cramping and spasm